Hello and welcome to Courageous Doctors, the news show for you and your doctor. On this show, we will cover Obamacare updates, other interesting healthcare news, and health and safety tips. Now let's begin. The Wall Street Journal had an article by Dr. Kokler, and Dr. Kokler used to be the special advisor to President Obama on the White House National Economic Council. And he's admitting now, after 6 years, that the White House was wrong to call for the elimination of all small doctor practices by forcing them to merge into larger statewide groups. Apparently, they thought that this would save money by everyone being on the same computer, although that makes absolutely no sense. And I quote, "What I know now, though, is that having every provider in healthcare owned by a single organization is more likely to be a barrier to better care." Dr. Coker, I congratulate you on that insight. I wish you had it 6 years ago. As many of us small practices who are the blood, heart, and soul of the American people are forced to merge into larger groups. And that's okay if people like larger groups, but you do lose that personal touch and you lose the personal communication. I'll give you one last quote. "Recognizing the strength in the small practices, the federal government now needs to write rules that make it easier for them to thrive under Obamacare and not tip the scales towards consolidation." Let's move on. The New York Times tells us that the U.S. Court of Appeals, the D.C. Circuit, ruled that consumers must be allowed now to buy health insurance that does not meet the ACA, which is the Obamacare healthcare standards. This is really new. It looks like, I'm not really sure what's going on with Obamacare, but it looks like it still has many challenges ahead of it, as you can see from that statement. The Washington Post says that Aetna will now only be in 4 states on the Obamacare exchanges. It had already left New Jersey back in 2013, and United Health Group and Humana are also limiting their exchanges. So you see what I mean? Health insurance seems to be pulling out of Obamacare. The Wall Street Journal cites a McKinsey & Company report that most insurance companies in this coming year, in 2017, will offer limited networks of hospitals and doctors. That's just really no good. It's just not good medicine. The Washington Post said that Obamacare is suing to block the merger of some of these large insurance companies, Anthem and Cigna and Aetna and Humana, like it had blocked the Pfizer-Allergan merger last year. So the administration is blocking the merger of large insurance companies, and the large insurance companies are pulling out of Obamacare, and deals cut that made the rules of Obamacare to encourage insurance companies to take away the bonus money from small practices that are now forcing them to merge and become more impersonal. So I really don't know where we're going, but I really hope that somebody's smart enough to get us out of this. Let's see what else. The Ledger said, this is good news, that the Hackensack University Health Network has managed to merge with Meridian Health, and they now have 11 hospitals between New Jersey and New York. So we've got some strong hospitals merging, and they are now second in New Jersey to the Barnabas Rutgers Healthcare, which is the largest healthcare system in the state. So it looks like some things are pulling together. The Congressional Quarterly says that, again, this is terrible, 13 state-owned exchanges are running out of money. What's going on? The Washington Post says that only 7 of the 23 Obamacare health co-ops have survived. The others have gone under. What is going on with Obamacare? The Ledger, this is interesting. Governor Christie reports that the New Jersey Family Care is running very well with federal money, and we have over 500,000 new patients signed on, so there's probably over 1 million patients on it. But if you talk to individual people that have to work off of family care and Medicaid, there just doesn't seem to be enough money. I know for us as pediatricians, we now have to buy some of the vaccines up front, and they're always cutting funds to some of the groups that we depend on to send patients to. So I don't know exactly what the governor says when he's depending entirely on federal money. I think we're going to have to get some state support or some other way to keep some of these programs running, but I guess we'll see what happens there. The Boston Globe said that consumers are now seeing steep hikes in their long-term care insurance. Listen to these numbers. A Fidelity study, the Fidelity Financial Group, if a couple retires at 65 years old and lives into 85 or 87, they would need $260,000 just for the rest of their health care and $130,000 for long-term care. So these are pretty staggering numbers. We have to figure out how people can retire and still maintain the health care they need, especially if they need home care nursing, home care aides, all the things that long-term care brings. And remember now, with what's going on with Obamacare, people are paying a lot of money out of their pocket for medicines, and I just don't know what's going on, how people are going to afford this. I know Congress is working on trying to find a way so people with chronic illnesses and seniors can afford their medicines. But I tell you, honestly, from what I see, people have to decide some days between having dinner and buying their medicines. So I just don't know what's going on with Obamacare. The Associated Press, the U.S. District Court has ordered Medicaid to cover hepatitis drugs, and the Star-Ledger says that New Jersey State Senate Health Committee has voted to have Medicaid cover the cost of treating the Zika virus in patients. We have, as you'll see shortly, we do have a number of Zika patients in this state, although there is no Zika as of yet in the mosquitoes in New Jersey. We do have a lot of Zika patients who have traveled elsewhere.
Hi, I'm Ingrid Burke.
And I'm Gina Unger.
Gina has known Dr. Berry in a professional and personal capacity for many years, and we are thrilled to be in his building. We are psychotherapists, and we offer mental health counseling for ages 12 and up. We do individual, couples, and family counseling. We're also excited to say that we have groups that we have for teenage boys and girls for social skills, anger management, and self-esteem building. If you need to reach us,
check us out at lifeworksnj.com.
Our phone numbers are also listed on that website if you'd like to contact us. Thank you.
Thank you.
Moving on to other healthcare updates, the CDC reports Zika virus in 300 pregnant women in the U.S. and in New Jersey as well, and 6 have birth defects. There are over 17,000 cases totally in the U.S. 300 of those are in pregnant women. Of course, we worry about the pregnant women because of the birth defects and brain defects in the babies, and also blindness and limb deformities. Now, of course, in Florida, the virus is in Miami Beach and South Beach area. There are warnings for pregnant women not to travel there because there the mosquitoes actually have Zika virus and were conferring them from one person to another. Some of those bans have been lifted in certain areas, so you really have to check with your local state area public health in Florida if you're traveling there. Now, as we said, there are 122 cases in New Jersey. The Washington Post states that the virus has spread from infected women to men. It's not just the men through sex giving it to the women can give it back to the men. And even caretakers who are caring for a sick patient can get it from body fluids and through even handling tears. So any of the body fluids, including tears, are infected. The good thing is that we do have vaccines that NIH has managed to start testing, and we're waiting to see hopefully when those tests are done, because really the only protection for these pregnant women to not have birth defects is to really be vaccinated, just like they would against the rubella, German measles. The vaccines prevented birth defects. We need that Zika virus vaccine to do that. All blood donations, according to the Los Angeles Times, now have to be screened for Zika. And this is interesting. The Star Ledger said that minnows, those little tiny fish, are being put into some of the lakes to kill mosquito larvae. And of course, we're also experimenting with genetically modifying, down in Brazil, mosquitoes so that they will not be fertile and sort of self-destruct themselves and die by not having their offspring grow up and not be fertile. There are different kind of sprays they're working on. So there's a whole different way that they're working to protect you against even having, to be bit by a mosquito or having these mosquitoes survive. Moving on, the Washington Post tells us that the World Health Organization is now vaccinating for polio outbreak in 5 African countries. Prior to that, polio mainly was seen in Pakistan and Afghanistan and wiped out from the rest of the world. So Lord knows how it got into Africa. I don't know if it's from all the wars or what happened, but I mean, Africa had Ebola, and now it's got polio outbreaks, so I hope they get that under control. And likewise, JAMA had reported, the Journal for American Medical Association, had reported that we're now fighting yellow fever in Africa and China, and there's a massive vaccination effort going on there. You don't want to get those diseases, believe me. Our own Department of Health has reported a measles outbreak that was in Arizona in a customs detention facility, but warns that there may be a connection to people in Jersey, I guess immigrants that have some connection to people in Arizona. So just be careful they didn't catch the measles. Washington Post reported on, this is scary, that brain-eating amoeba, Naegleria, that you catch by stirring up the water in the bottom of lakes or old unkept up pools and warm fresh water, hot springs, killed another person in North Carolina. So, it's not very common, fortunately, but it is almost uniformly deadly. And basically, this parasite's in the bottom of these lakes, and by kicking around the dirt in the lake and doing somersaults, and they breathe this thing in through their nose and they die. So I certainly wouldn't kick up dirt in a lake. The Ledger reports that an Edison company is recalling walnut snacks that are infected with listeria. It's United National Trading, and the labels are Nature's Promise, Woodstock, Market Basket, and Woodfield Farms. So I don't know if by this time the recall is still ongoing, but if you don't want to get poisoned with listeria, please check before you buy these products to see if they're all gone. Washington Post, the second patient was detected with that horrible, resistant, scary bacteria carrying what they call an MCR1 gene, which makes it resistant to every drug we have. Again, not very common, no time for panic yet, but it's out there. We're seeing it in America. It was seen around the world before that. We've got to help these the pharmaceutical companies just make more drugs to fight these bacteria. We've got to put the money into them and stop. Right now Congress is doing everything it can to stop them from getting higher money for their research, and I can see why, because nobody can afford medicine, especially with Obamacare. But still, we've got to let these people do their research if we're going to have new medicine to fight these resistant bacteria. Let's see, Washington Post. Here's an example of Congress. They're going after the EpiPen company because it had a large increase. I actually caught the testimony on TV, on C-SPAN, and they really drilled into the president of the company, and she did not adequately explain to them although I think she attempted to, why she had to raise the prices of the life-saving adrenaline drug called EpiPen. You know, like if you have a nut allergy, you have to inject that or you'll die. It was like $50 or $100, and it went up for like 2, and then it went up to $600 for 2. And there were some takeovers and some shared costs with other companies. Apparently, the testimony I heard was not satisfactory to the Senate committee, and so the company's doing what it can to bring the price down. I have a lot of patients that need EpiPen, and I know the company. If you're a certain level above poverty, you can get it, I think, for free. And above that, if you look for coupons, you can get it for half price, $300. It's still expensive, but you only need like to buy it once a year. But some insurance companies will still foot the whole bill for you if you're lucky. So I think that the company is trying to work with the government because it is a life-saving drug. But this is another example about where the drugs are very expensive, especially in this case, they're life-saving. But on the other hand, the company needs money to do research and development. So there's got to be a balance there. And I don't know if Obamacare is the answer or not, but somebody's got to be smart enough to give these companies money to do their research, but at the same time make the drugs affordable or nobody can buy them. Let's move on to health and safety tips. The Los Angeles Times says that the American Academy of Pediatrics is urging states to stop giving waivers to families whose children are refusing to be vaccinated and telling pediatricians that they have the right not to accept them as patients. Have you ever heard anything that stupid? I mean, this to me is what is the essence of what happens when you go huge groups and you lose that mom and pop practice that I'm proud to be one of. And Obamacare wanted to drive out all small practices so that you can come up with doctors that say, if you don't want to get vaccinated, you can't come back to my office. How stupid is that? I believe I took an oath, I hope they did, that I'd be here to serve the public. I want to work for the guy down the street that's bringing his kid to me and I'm taking care of them. I don't want to work for some huge group that says I can tell them not to come to me if they don't want to get a shot. Maybe the big group just wants to get a lot of kickbacks or money selling the shot. I don't know what their reason is. But can you imagine, and the Academy backing this? How horrible. Can you imagine the people I look up to would roll over in the graves if they heard that there were doctors that told people, don't come back to my office if you don't do what I tell you, like get a shot. Are these doctors so afraid of illness? When my dad had the practice that I now take over, he saw measles and all these diseases in the office. He didn't tell people, don't come to my office if you're sick. Excuse me, I'm a doctor. Where are you going to go when you're sick if you're not going to go to my office? So this is just stupid. And I love the Academy of Pediatrics. I think they made a mistake. But how can you tell a patient that you've grown up with? See, here's the thing. A local mom and pop, I know my patients by name. I talk to them all night. I'm not going to tell them not to come and see me. Is this what you want to do, Obamacare? Drive small practices out of business and then tell them don't come to us if they're sick? Don't come to my office if you don't get shots? Is this what you really want? Or do you want me to stay in touch and stay with that patient and try to convince them to get the vaccines? The vaccines are good for you, of course, but don't throw them out. Have a loving, warm relationship where they're welcome to come and be with me. I mean, can you imagine? Oh, boy. Anyway, on a more interesting note, hopefully, the Washington Post says that there are new indications for our sleep schedule. And you can see on your screen the hours that the National Sleep Foundation has said. Newborns need 14 to 17 hours, infants 12 to 15, toddlers 11 to 14, preschoolers 10 to 13, school age 9 to 11, and teens 8 to 10. I wonder if all of us get that sleep that we really need, and should try to. All right, let's move on now to health and safety tips. The Journal of the American Medical Association, JAMA, says that the OIG, the Office of Internal Investigation, reports delays in the FDA's ability to recall infected foods, probably getting better. They say certainly getting better since the 2011 legislation. That was the Food and Safety Modernization Act. But still in 2014, you remember all those peanut butter things, cheese, the peanut butter with salmonella, the cheese with listeria. There's a whole host of them. The FDA had delayed 6-8 months before telling companies. They were hoping the companies would voluntarily recall. They have apparently the legislative ability to now force companies to close and recall foods, and hopefully they're going to do more of that. The interesting thing at that hearing on the EpiPen thing I mentioned earlier, the FDA was sitting there and they said to the FDA, do you have enough manpower, woman power, scientific power, to encourage other companies to make a competing drug against EpiPen? And the FDA said, we have thousands of people waiting to get their drugs approved. I don't even know when we're going to get around to it. We're trying to, so somebody can compete with the EpiPen that's very expensive. So how is the FDA even going to begin to look at all these food poisonings? We have wonderful networks to pick up food poisoning. It's just you have to put it together, enforce it, and get it off the shelves before we all kill ourselves. Nice thing, right? Okay, the Ledger says that Congress passed a bill to protect consumers from products containing harmful chemicals. And the Washington Post says that the FDA is banning triclosan in liquid soap and triclocarban in bar soap. However, these poisons are still found in hand sanitizers and wipes. Figure that one out. The Ledger says that we still have elevated lead levels in the Newark school children, double that of the state average, according to Quest Labs. That is a lab that does blood tests. Washington Post says that 500,000 hoverboards have been recalled over battery fires and explosions. So if you own hoverboards, buy a fire extinguisher or get the battery fixed. The Washington Post says that the CDC found violations in 80% of public pools, hot tubs, water playgrounds in the 5 states they looked at in a 2013 study. They found urine, parasites, and chemicals. Lovely. The Washington Post says that the FDA is warning of a harmful bacteria found in raw cookie dough. For example, people were hospitalized in 20 states with Zika toxin poisoning. Don't eat raw cookie dough. The Washington Post says that the American drinking water has levels too high in PFA. Have you ever heard of that one? Polyfluoroalkyls. And this was according to an environmental science and tech letters group. And these are unregulated chemicals, lovely, so we no way to stop them. They cause cancer, hormone disruptions. These, if you're wondering what PFAs are, according to the Washington Post, they're found in iron stick coatings, those iron stick coatings on pans that you cook with, food wrappers, water repellent, clothing, and firefighter foam. Lovely, that's what we're drinking. The UST News says that there has been an increase in trampoline injuries from trampoline parks, and this is true. I see this in my office all the time. With the advent of having all these trampolines available through trampoline parks, I get these injuries almost daily, if not weekly. And lastly, according to the Ledger, 2010 data shows that 42% of stroller injuries end up in concussions. That I did not know. I thought the strollers would protect the kids, just like if you fall down the stairs in a walker, it generally protects them. The kids that I see get injured fall out of their heads straight down on a cement floor. I've never seen this, but you can't lie with the data. So that's pretty pretty unnerving, and that 53% of carriers also end up in concussions. So this is news to me. Honestly, I haven't seen it, but the advice is don't hang bags on the handles of the carriers and don't let children hang on to handles. And that's it for this month's news show. Hope you enjoyed it. Please feel free to call us with your comments. Have a nice weekend, and we'll see you next month.